Hello, lovely. Nice to meet you. I'm Dr. Nicola, one of the dermatologists here at the clinic. How are you? Good. I'm good, thank you. So, I'll be carrying out your skin examination today. Alright. Now I'm going to start just by observing your face, okay? So, if you could keep nice and still for me and refrain from making any expression. Thank you. So let's see what's going on. Close your eyes, please. And you can open. Okay, wonderful. Can I have your date of birth, please? And how old are you? Thank you. Great. Do you have any concerns? Okay. Yep. Yep. Thank you. So you're concerned about dark circles, signs of aging, and blackheads on your nose. Okay. Now, your dark circles are mostly here and here. Alright, so the inner corners of your eyes. Alright, very commonplace. The rest of your under eye are actually fine. Okay. Now you do have some hollowing there. Alright, so it's indented in, which makes dark circles look worse than they are, and that's what's going on here. Okay, now when I have a touch, I'll be able to feel how deep the hollowing is. Alright, yeah, but other than that, you know, they're not drastic, but I can see why it bothers you. Alright. Now, the blackheads on your nose, you do have quite a lot of blackheads, if I'm honest. Yeah, and you do have that oily, greasy shine all over your nose. Is that common? Yeah. Now, the oiliness is going to be making the blackheads actually worse. Okay. Yeah, so you're going to be producing more oil, and then your pores get blocked, and dirt and grime goes in, and then skin starts to grow, and then it covers it all up again. Alright, it's like a vicious circle. Okay, now by looking, some are quite superficial and some are quite deep. Alright, so it would be a good idea actually to do an extraction on your nose, just to remove as many as possible without causing too much damage. Alright, so you may have to come back again if you would like some more doing. Alright, but we do need to get the oil under control on your nose. Okay, my lovely. Alright, you don't really have any blackheads anywhere else. Okay, I can see a couple of milia, like one here and one here, but other than that, no. And I can cut those out as well if you really didn't like those. Okay, now with the aging, now are you talking about everywhere or is it under your eyes? Yeah, okay, because there's not really any signs of aging, if I'm really honest with you. Okay, your skin looks very, very youthful. Okay, it's very nice and even. It just looks beautiful, if I'm actually really honest with you. Now under your eyes, I can see some fine lines. Alright, just slightly there and there. Okay, it's not even crow's feet, my lovely. No, it's literally just underneath there. Okay, very, very common to get lines under there, especially if you've got dehydrated skin. Alright, and if your skin barrier isn't great. Alright, yeah, but I want to have a feel and really good close examination in a moment, and I'll be able to, you know, tell you a bit more about that. Alright, but just by looking, you know, I'm wondering if the lines under your eyes are slightly to do with aging, but I'm wondering if they look worse than they are because your under eye area is dehydrated. Yeah, you'll be surprised actually, most people's faces are dehydrated and some patches are fine, others are really bad, and yeah. Alright, so your concerns there. Right, are you in the sun a lot? Okay. Do you wear an SPF? Okay. Could you tell me what skincare you are using at the moment, if any at all? Okay, so cleanser. Yeah. Excellent. So that's actually pretty good, my lovely. Alright, so you're using a cleanser, which is great, a toner, you're using a moisturiser and an exfoliator once a week with a mask. That is fantastic. I can see why your skin is looking great. Alright, what products in particular are you using? Okay. Fantastic. I love that. Brilliant. Okay. Now, you're definitely missing an eye cream, I would say that, and even potentially some kind of serum. Alright, but I will discuss products and things with you later. Alright. Okay. Thank you for sharing all that with me. Okay. So, are you on any medication, my love? Yeah. And what are they for? Okay, wonderful. Do you have any allergies? Excellent. So, what I'm going to do first, if it's okay with you, is take some pictures. Is that all right? Okay, so just making sure the cameras are in position. Wonderful. So if I can get you to just stay nice and still for me. All right. No expression. Turn that way. And back and face that way. Excellent. Thank you very much. Okay. I'm going to get you to do some expressions now. Okay. So if you could start by smiling for me and just holding it. Thank you. Okay. Thank you. Now can you frown for me? Thank you. Raise your brows. Okay, relax. Close your eyes for me. Open really wide now. Just hold there. Okay, can you just scrunch your face for me? Okay, relax. Do you mind pouting? Okay, you can relax. Wonderful. I now need to do the same again, but take pictures, okay? Okay. You can raise your brows and hold it. Frown. Pout. Smile. Okay, now turn that way. Frown. Smile. Pout. And raise your brows. Back at me. That way. Frown. Pout. Smile. Raise your brows. And back at me. Good job. Excellent. Now I'm going to get my light. Alright, it's going to be bright, so you can close your eyes if you wish. Okay. You can really see those blackheads. Yeah, definitely could get quite a lot of that out actually, which is good. Okay, look at the darkness. Yeah. Not too bad. Okay. Thank you. I'm just going to get my magnifying glass. Okay. This can give me a close-up of your pores and blackheads, okay? Alright, you can close your eyes if you wish. Yeah, there's definitely too much oil production on your nose, causing all of this. Do you ever get breakouts on your nose? Okay, so it's just the blackheads, okay. I can see that you've got some scarring on your cheeks. Did you have acne or a lot of breakouts? I thought so when I was having a look, but I can see them a lot clearer with the magnifying glass. When you had your breakouts and your mild acne, did you ever get any blackheads then, or was it literally just breakouts? Okay. Yeah. The scarring's actually quite minimal, if I'm really honest. It's just a couple. I'm guessing whatever you've been doing over the years has really helped keep the scarring under control. Alright, but there's just a couple of deeper patches that when I'm really assessing I can see. Alright. How old were you when you had that? Okay. Do you ever get breakouts now? Whereabouts? Okay, so mostly on your chin, every so often. So quite hormonal. Alright. You don't have any blackheads on your chin really, maybe the odd one. It's just, on your nose. Okay. And the oiliness is just on your nose as well. Okay. Sometimes, people have a form of acne and it presents in just blackheads. Alright, you'll tend to find it on people's nose and chin and on their chest and sometimes on their back as well. Alright, okay. I'm not saying that's what you've got, alright, but I'm going to have a look and touch and, I'll assess and see what I think. Okay. Okay, so what I'm going to do first is touch your face without any gloves, okay? I just want to feel and see how it feels. And I know it's a little bit clammy in here, which doesn't help, but, Okay, can I touch? Okay. I just want to touch your nose slightly. Okay. Okay, so face actually feels quite soft, my love. Okay, soft and smooth to touch. Okay, and definitely a greasy, oily nose. And your chin actually feels slightly oily when I was touching. Alright, okay. Now, what I'm going to do is just pop on my gloves, and then I'm going to check your oil production. Okay. Okay. Yeah, there's a lot of oil on that. Okay. Let's check your chin. Yeah, only slightly oily there. Okay. Right, so now I'm going to assess the skin in more detail. Okay. I can feel quite a lot of bumps on your nose. Okay. Your chin. Yeah, your chin's quite smooth. Okay. Okay. Just make sure the oil is off. Okay. I do have the many other classic ones, not too big though. Okay. Forehead is quite dehydrated. Yeah. And then those little lines there are from your dehydration. Okay. They're only really prominent when I'm close up, and then obviously I'm squeezing, and then it looks like a bar of soap. You know, when you've had a bar of soap and it's been wet and then it dries on the side and all the cracks, that's what your forehead looks like, but not as excessive as that. Okay. Yeah. Which shows that, you know, you're dehydrated, and if our skin is dehydrated, then, you know, it can look older than it is. Alright. And then if we're dehydrated for too long, it will then, you know, fine lines and things can appear and become deep set. Okay. And do you have some pigmentation? Like little freckles. I couldn't see them before, but now I'm closer up. I can see you do have some dotted around on your forehead. Do you have them all the time? Okay, so that's probably due to the summer. They may fade, but they may come back, and each year it will just get more and more. Okay. So if you can, you know, do try to wear a hat and, you know, use some form of SPF. Alright, but have a look round for some good ones, okay? Some natural base ones or something. You don't really have any excess skin on your forehead. Alright, it's quite nice and supple. No, my love, there's not anything there like that. Alright, it's when you smile, obviously it crunches and scrunches up, so they become noticeable then. But if you're just sitting there like that now, there's nothing going on. Alright, it's all very, very smooth. Okay, there's no sagging there either. Okay, this side is exactly the same. Okay, it's quite nice and tight. Alright, that's good, nice and tight, which is what you want. Okay. A nice bounce on your cheeks. Yeah, both sides, good. It's a really good bounce. Okay. Now, I do have some redness here. Okay. It's not getting any worse when I'm touching, which is a good thing. Alright, do you normally get red? Okay, so you think it's from being out in the sun. Okay, well that answers that one. You do have some little pigmentation patches here and here, but more like freckles, okay, than actual pigmentation. Now, do you have them normally? Okay, so you find that only comes out in the summer. Okay. Yeah. You might find as well that over time, you know, they don't go. Sometimes they appear to fade, and then obviously when summer comes again, they flare up, and then you have more than you had to begin with. because when we are damaging our skin, it damages deep down first and then brings it to the surface. Okay, these are just some little freckles here. Okay, we tend to get age spots and things as we get older anyway, but that's normally too much sun exposure, and your melanin is not as functioning as it should do, so it gives us these patches. Good bounce and good elasticity. Okay, there's no puffiness here and no sagging at all. It feels really nice and supple, which is really good. Nice and strong. Yeah, it's good. Let's have a look at this side. I'm guessing it should be pretty much the same. They usually are. Yeah, that's really good as well. That's wonderful. No sagging at all, and yeah, that's really good. Yeah, your face isn't going any more red, so it's not being irritated, so I wouldn't say it was typically sensitive skin. Yeah, really good bounce, good elasticity. However, your cheeks are dehydrated. Okay, not as bad as your forehead, but they are still dehydrated, especially in this little section here. Alright, but because you've been out in the sun, a little bit red, a little bit tight, it tends to make our skin more dehydrated. Okay. Lovely. Not really a line there, my lovely. You may notice it if you've got makeup on. It might become more prominent then. Your lips are a little bit rough, dry and cracked, quite dehydrated. Make sure you are using a balm or oil or something like that, especially if you're going out in the sun or if you're going out in the wind. Okay, make those nice and supple. Okay, otherwise they'll crack and bleed and things like that. Okay, so you could just wear some lip oil, lip balm, lip gloss, something when you're out and about, even some lipstick. But I would definitely make sure you are exfoliating your lips once a week at least. Twice is best, just to remove all that dead skin and build up. Then put a nice lip mask on, okay, whether it's just like a balm or a proper mask, something like that, just to really get the hydration back into those lips. Okay, and if you regularly apply like a lip balm, lip oil or something like that, they'll really go nice and supple. Okay, that's what you want. But your upper lip is fine, there's no lines or anything there either. It's quite nice and it's not dehydrated. Okay, which is really, really good. Okay, and like I said, no, that is fine. Okay, my love. So let me just have a look under your eyes. Yeah, so I can feel the hollowing here. It's quite a bit down. Yeah, so that's why we can see a lot of that colouring more. And obviously if you're not sleeping, or you've slept too much, or you've left makeup on and things, it can make under your eyes discoloured. And if you're not using an eye cream, or a good eye cream as well, you're not hydrating under that area and keeping it nice and supple, and you're not helping getting rid of the puffiness and dark circles. Alright, but your dark circles are just in the corner, quite bluish. Alright, and here is quite a normal skin tone. Yes, it is slightly different colour to the rest of you, but it's not typical dark circle. Alright, but under your eyes are very dehydrated. Yeah, and that's what you've got, these little lines here, and when I'm squeezing I can really feel it. Now if you put makeup on, you may sometimes have that crepey look, yeah, or your foundation or your concealer's kind of going patchy and coming off. That's because you're not hydrating that area. The skin barrier needs repairing. Okay, we need to go deep within. Yeah, and that could also be contributing to the discoloration under there as well. Okay, there's no puffiness, no, it feels quite fine. I mean, you may say get up in the morning and your under eyes might be a little bit puffy, just do some cold therapy or something, lymph drainage, just to remove any of that puffiness. But with the hollowing slightly, shadows appear and it makes things look darker. Alright, so if you are doing any makeup under there as well, you want to kind of cover it up, but you also want to make sure there's no shadows. Okay, yeah, under your eye area is obviously a thin area, but yours is feeling a little bit too thin. Alright, and that's why you're getting these fine lines look quite prominent. You're getting the creping, the patchy concealer, and it feels a little bit dry and tight under there. And when I'm squeezing, the dehydration lines are quite excessive. Alright, now I know you are putting your products on, and I'm guessing you're going up to your eyes. Good, but you're not having a dedicated eye cream, which I think you need to. Alright, okay. Yeah, so I think in terms of aging, my lovely, it's more under the eyes that is more noticeable to me. Alright, obviously if I'm going to get you to smile or frown or whatever, things are going to come because, well, they're expression lines, that's what they do. But obviously as we get older, they go more deep set, and but your overall skin isn't wrinkly or anything like that. Yeah, it's tight, quite nice and supple, good bounce, good elasticity. There's nothing to think, oh, you're not really old. You're just picking on the expression lines. All right. Okay, but like if you smile, you're going to get expression lines. It's just how it is. But obviously, if they go deep set and you don't like that, you could always have them filled slightly or something like that just to smooth it out. Okay, same with your under eyes. If you're really getting, it's really troublesome for you, it's really bothering you, then you could have small amount of filler just there to fill that out a little bit. You don't necessarily need to go all the way across, and that'll just smooth it out. And the stuff that actually goes in you, the filler, has got kind of like a brightening effect in it as well. You could do that, but you don't want to overfill that area because then that's going to look worse, and then you start getting puffy and it just looks awful. So, what my advice would be is to work on it with product. Okay, so, really hydrate under that area. You want to make it really nice and supple. You know, so what you want to be doing, you know, make sure you are bringing all your products up. You know, don't get it in your eyes, but make sure you are bringing it up. Okay, and then when you're popping on an eye cream, you just want to dab outwards like this, and then little circular motions as well, always going up, up, up with anything that we do. When we obviously are aging, you need to lift it. All right. Okay, and you want to be, you know, something like a caffeine product under there, you know, some ginseng, something like that, and even a retinol, you know, a nice retinol product under your eyes just to help that area, especially if that is your main area of concern. And you might not want to start using retinol all over your face or tretinoin or something like that, so maybe just do it under your bothersome area, which is under the eyes. All right, could be doing something like that. All right, you know, and get some eye patches. Do you ever use those? You do? Good. We'll try and, you know, get a few different ones. Have a look around. You know, any like the hydrogels, biocellulose ones are the really good ones to have. Yeah, something like that, and just get them and pop them like the small end there out, and you can flip them and do it the other way as well. Okay, personally I like to have the thinner bit here, but it's just up to you what you want to do really. Okay, but yeah, you could do with using eye masks, I think, every day for at least a week. All right, so in the morning, if you're feeling a little bit puffy, you could pop on your eye mask there and, you know, leave it on for about 10 minutes. Take it off, you'll feel nice and refreshed. Your face, your skin might feel and look a lot brighter. You will look more awake. All right, or you can do it before bedtime. All right, it's totally up to you. Or you can use it morning and night, but make sure you've got something that's gentle enough to do that. All right. Okay, and then maybe after 7 days, you know, do it every other day, and then maybe just go twice a week. Okay, something like that. Find what works for you. All right. Okay, same with a face mask, my lovely, but you're doing the right thing by exfoliating first and then using the mask. All right, so you need to be doing that twice a week. Okay, so you want to really exfoliate your face with whatever product you are using, nothing too abrasive. All right, and then pop on a sheet mask of choice. All right, something hydrating, you want something plumping, you know, something maybe brightening, yeah, something like that, you know, something's really going to help. But because you've got your oiliness on your nose, I think it'd be good just to get a clarifying product just for your nose, something that's going to draw out the oil. All right, impurities. You could get like a clay, a black clay, and just paste it on that section, and then, you know, put your mask all over then. Something like that will be really good for you. All right, I think so. And any mattifying products as well to work on this. We need to get the oil under control, and then, you know, in turn that will stop producing more oil and we'll stop getting all your blackheads and that. But if you do exfoliate twice a week, you know, make sure you're doing a good exfoliate on your nose, so you've not got any layers of skin building up on any impurities, which is why it's also essential that you are cleansing your face morning and night, and a double cleanse as well. Okay, so product in, really give it a good scrub round and rinse it off. Same again, rinse it off. Okay, then you could go in with cool water to close up any pores, or a hypochlorous solution would be absolutely fantastic for you. All right, because that will help control any bacteria, soothe the skin, hydrate the skin, and, you know, remove any bacteria. It's really quite a nice product. Something like Napier's and, you know, Iso Skin do stuff like that, and you can just use that as your toner instead. You know, sometimes if you're using proper toners, you know, they're actually can be quite oily, and, you know, you're putting that on, or they're quite drying and dry your skin more. So it's about watching what you are using and what goals you want on your skin. All right, my lovely. Okay. But, you know, exfoliate twice a week and use your mask then. All right, if you do that. Okay. And then you want to be using, like I said, an eye cream. You know, CeraVe Eye Repair is a fantastic starting point for you. All right. And then the advanced ointment that they do as well. It's got 3 essential ceramides in it and hyaluronic acid, and you can just apply it under that area, even under makeup. All right, so that'd be really good. Something like that would be great. All right, to really help penetrate under that eye. You know, maybe you can use a full tube of it, you know, using it correctly, and see how we get on then. And then I'm thinking that you could do with a nice serum of some sort. Maybe, you know, one by Curel, the Japanese skincare. Just a nice anti-aging, soft serum. Something like that. I think we don't want to go too far in. We want to do little bits at a time. But your skin is very youthful. It's quite even. You know, a little bit of discoloration under your eyes, slight bit of dark circle there, blackheads in your oily nose. You know, slight bit of scarring on your cheeks, but not really that visible. Dehydration all over, especially under your eyes and forehead. Couple of freckles dotted around. Okay, and obviously expression lines are prominent when you make the expression. But yeah, your skin is actually in really good condition and you are looking after it fantastically. All right, these little changes now are really going to help improve your skin. Okay, and I can guarantee you, if you stick to this, you know, within a month or so, you'll be feeling a lot better. Okay, you'll be looking a lot brighter, skin a bit more supple, more hydrated. You know, and use products that are going to, you know, hydrate your surface as well, and then find ones that you could help deep within. Okay, and it would be worth looking into a collagen supplement as well now, and see if there's something that it can work within, and, you know, have a good look around at different types of supplements. You know, some people swear by NAD supplements, and different ones like that. So, you know, but collagen is something that I think you should have a look into. Yeah, just to help. Okay. Does all that make sense? Okay. Yeah, using maybe like lymph brushes would be great as well, to like brush up. You know, it'd be lymph drainage. If you can afford to have regular facials as well at a salon, you know, that would be fantastic. Okay, if you can deal with microneedling as well, that would be really good to do microneedling and then put a serum on, or you can put the serum on and then roll it in. All right, have a read and a look into things. I will email you, you know, some recommendations as well as obviously my findings. Okay. And what I do is I assess everything after you've gone, and then I can send over appropriate treatment plan with product recommendations. I know I've given you some now, but there may be others that are quite appropriate. But, you know, you want to keep it hydrated. It's going to help the aging process. Get a bit of collagen into you, that should help as well. Lymph drainage, again, that's really going to help, and SPF, and make sure you are covering your face if you don't want to wear SPF. Okay, so you're not, you know, and get on top of this. All right, my lovely. Maybe go to the doctors and have some bloods done. I mean, I could do some today. I could do some bloods to, you know, see if there's any hormonal imbalances. We could do that. I could get you in with a nurse afterwards and they can take some blood. I think that would be a good one to do. Okay. But yeah, I think, you know, you could do with maybe an extraction. Okay. So is it all right with you if I can actually book you in for a medicated facial? Okay. Now, if you come into me for a facial, I can do one and I could carry out an extraction. Yeah, I can concentrate on your nose, and then if you see anywhere else I can do that, and I could apply some proper products to help with the oiliness on your nose, and obviously remove some of your blackheads, and gives your face a nice clean and a nice base. Would you like the sound of that? I can certainly do that for you, my lovely. I just think rather than rushing an extraction, if you come back for the treatment, and then I can, you know, do it properly. Yeah. Okay, so let me have a look. I could do in a couple of weeks. Okay, I can do same day, same time. Wonderful. So I'll book you in for a medicated facial with extraction. Okay. Okay, you should get a text with that. So wonderful. Any problems, please let me know. I don't need to do any more checks today now. All right, I'm happy with everything. I'm going to have a look at all my notes and the images, and then I'm going to write a report and email it you. Okay, in a moment you can go and sit in the waiting room, and then one of the nurses will come and get you and take some blood. I should get the results back in a day or two, so I will also email you those results and my recommendations. Okay, then I will also send you over some recommendations of products, some brands and types and different things. Then you'll come and see me, and I'll carry out the treatment and the extraction, and then hopefully you'll have a plan going forward on what to use to maintain your skin at home. Alright, and I could look at prescribing you a tretinoin or something like that to help prevent any further aging. Alright, but we've got all sorts of different things we can do, and you can come to see me regularly if you would wish to have, you know, regular dermatology facials. That's fine. Okay, do you have any questions? Alright, well I know this has been a little bit of a long examination, but I just like to be quite thorough with my patients and, you know, give you the best treatment possible. You're very welcome. So if you go and take a seat in the waiting room, one of the nurses will come and get you. You take care now. Bye bye.